Hi, my name is Dr. Colette Brown-Graham. I'm an obstetrician gynecologist and I practice in the Wellington area. I'm actually the current president of the T. Leroy Jefferson Medical Society. I have been involved with the organization for upwards of maybe 8 to 10 years. The organization is primarily physicians of color who actually have a passion for giving back to the community. We do health fairs, we do anything helping in the community with mentoring, mentoring of students, and this is part of our initiative and passion. I'm originally from Jamaica, West Indies. I came here when I was 13 years old. We came like many other people at that time because my parents wanted to move and have better for their kids. So we went to Miami, Florida. I went to Duke University for undergraduate after high school, graduating in Miami. And after 4 years there, I went to medical school at the University of Miami. I was blessed enough to have a full tuition scholarship, which was a wonderful thing. My residency was in Boston at Boston University Medical Center, and I also was going to save the world, so I have a public health degree from Harvard University. I decided to practice obstetrics and gynecology because I actually love it. I love delivering babies. I love taking care of females. I love every aspect of OBGYN, and if you ask me tomorrow what I would be, I would tell you I still want to be an OBGYN. We came back here, myself and my husband, because we ended up practicing in Rochester, New York, and because I needed to be warm. So coming from the West Indies, it is very cold in Rochester and Boston. We actually were moving colder and colder, and I wanted to get back to where it was warm. I have 3 other people, actually 4, but one's a dog in my family. There is my husband, Alvin Graham, who is an industrial engineer, and we met in Boston. And there are my 2 children. They're twins, Gabriel and Giselle Graham, who are actually seniors at Dreyfus School of the Arts. They're actually violinists, and they love the violin. And I'm hoping that at least one of them follows me into the world of medicine. She actually plans next year, she's going to be a senior on doing chemistry for her undergraduate degree. And my dog, Chance, who has been with us for 15 years, and he's my 10-pound little friend. So that's my family in a nutshell. Outside of medicine, I actually do not too much. Because obstetrics and gynecology, if you love being busy, it's a very busy profession. You have to be up at night delivering babies. We actually do surgery, and so that takes up, and then you have to also see patients. And if you couple that with being president of T. Leroy Jefferson Medical Society and doing events such as mentoring and taking care of 2 kids and actually trying to make sure that your marriage stays wonderful, that actually is an extremely full life. I do attend church and I go to prayer meetings, but apart from, I love my garden, if that's something you do outside of medicine, but I don't really get to spend the time in it that I should because I'm really busy with medicine and my family and T. Leroy Jefferson Medical Society, and that actually takes up the majority of my time. In my 3rd year of medical school, I decided that I needed to pick a profession because that's when the professors expect all of us to pick a profession. So you basically start rotating into different areas. And I was at a loss. I knew I didn't want to be an internist. I knew I didn't want to be a pediatrician. I was like, I don't want to be an anesthesiologist. And what drew me to obstetrics and gynecology is that you actually get to see and do everything. You get to do some surgery. You get to take care of some patients on a primary care basis. You actually absolutely get pediatrics because you see your patients and they bring them in at all different ages. So you're actually, and the best thing about it is that you develop lifelong relationships with your patients. So the bonds that you make with your patients are actually almost unbreakable. When you deliver someone's baby, essentially you're part of their family, actually forever. Some of the challenges that you face in all of medicine right now is that it really has changed. And I'm going to say that with the caveat that nothing stays the same that you ever are in. So medicine has changed, And I think some of it's for the better and some of it, unfortunately, has been for the worse. I don't remember when I first started as much paperwork as we have. We have too much paperwork, and I think the computers, although I love them, and we've been computerized for several years in my office, actually adds more burden and more work to a physician than not, because you can take your work home with you. I'm never without my tablet, my computer, so I always have the results. So I can't say, well, I'll go tomorrow and look up your results. I actually can look them up right at that moment. So being always connected, believe it or not, it brings more work, not less. So the other challenges in medicine are always going to be the malpractice aspect of it. And don't let anybody fool you into thinking that that's not something that we care about. It's very difficult to take care of patients year after year, month after month, and to have something that is not your fault be a reason for you to be worried about a lawsuit. So that is something that I think is a challenge that permeates all of medicine. I don't know how we're going to change that, but something that probably should be addressed with universal health. And the final challenge, I think, is just the one of commitment to time. I know way too many physicians that are divorced and that don't end up having a family because they're so busy. And I actually promised myself that my family would stay as important to me as the patient care that I give out, because you have to be happy in your social life to actually be a good physician and a good provider to other people. I think that careers in medicine are boundless. And the best thing about medicine is it's portable. I don't have to be a doctor here. I could be a doctor in Utah. Not that I'm going to Utah. I could be a doctor in any state I want to be, because that is the real incentive with why do medicine. And it's the same with any aspect of medicine. If you're an ultrasound technician, you don't have to be an ultrasound technician in Florida. You can go be an ultrasound technician in California. Of course, you have to pass their boards there, but my point is that that is such an important thing, and it's one of the things my mother told me about a profession. She said, pick a profession that you know you'll be needed. Unfortunately or fortunately, people will always need someone to take care of them, and I think if I was to give anyone advice about why do medicine, it's because it's a job that you will always have.